Welcome to Your Health. I'm your host, Rhonda Alfred, and joining me on this episode is Mary Miller, Vice President of Physician Services at Terrebonne General Health System, and Almy Savoy, Executive Director of the Foundation for Terrebonne General. Today we will be discussing the state-of-the-art Terrebonne General Mobile Care Clinic, which will help to provide health and wellness services to the Bayou region. Welcome to the show, Mary and Almy.
Well, thanks for having us here.
Thank you.
All right, well, let's get started with Mary. Tell us a little bit more about yourself and your role at Terrebonne General.
Well, as you stated, I'm Mary Bergeron Miller. I'm the Vice President of Physician Services at Terrebonne General Health System. I've been with the organization for over 38 years, and my responsibility actually is to have executive oversight of physician services, key credentialing positions such as physicians and nurse practitioners, management of various healthcare service lines, and most important and most recently, which I'm very excited about, is to have oversight of the mobile medical clinic.
All right, well, thank you. And Almy, tell us more about your role.
I'm Almy Savoy. I am the Executive Director of the Foundation for Terrebonne General, and I've been here for now just a couple of years, but hopefully I'm trying to get as much done as we possibly can in that short period of time. I am primarily responsible for fundraising for the foundation. The foundation is a separate entity from Terrebonne General, so one of the things that we are always striving to accomplish is to be able to provide our, to fulfill our mission, which is to provide health and wellness services to not just the Terrebonne General services, but throughout the community as a whole.
Okay. All right, well, let's get started. Mary, can you tell us what is the purpose of the mobile care unit?
Absolutely. Let me tell you about the mobile care clinic first. It's actually a customized vehicle that is equipped with 2 patient exam rooms, medical equipment, and medical supplies. And our primary purpose is to bring healthcare services closer to home. And when I say closer to home, I mean actually to you, because of the fact that we have the ability now with the mobile clinic to actually travel throughout the parish of Terrebonne and provide healthcare services to those that may have limited or challenging opportunities to have access to healthcare services.
Okay, sounds like a big goal.
It is.
Tell us a little bit more about specifically what kind of healthcare services will be provided.
So when I look at what we're providing on the mobile clinic, I actually put it in 2 buckets. One being preventive care and the other being health promotion. Under preventive care, our goal is actually to reduce the risk of disease, disability, as well as to reduce the opportunity of hopefully don't get to the point of death. And that's in various buckets, one being screenings. We're going to do screenings as far as like blood pressure checks to see if there's a problem with hypertension, blood glucose, and that may be in the form of a regular glucose, or it may be in the form of what we call a A1C that would measure your average blood sugar over time. And that would be an indication of maybe the person is pre-diabetic or diabetic. The other elements, other things that we would do is to measure oxygen saturation to see if there's some cardiovascular issues or heart disease issues. And that's very important because there are treatment modalities and medication management that we can do to try to start at earlier on for prevention standpoint. The other aspect would be vaccination. Tetanus, flu, COVID are some of the things that we'll do. A big component is to actually have physicians and nurse practitioners on the bus to be able to do examination, physical examination. It's just like the same process of going to your primary care physician. As far as health promotion, what I like about health promotion is that it actually involves the patients and get them to take control of their health journey. So for us, it's be able to provide education and resources, education on lifestyle changes. It might be smoking cessation, it may be on cancer, it may be on weight management or nutritional management. The other thing is to be able to connect our residents and patients to the community as far as what resources are available to help them to manage their disease process.
Almy, tell us about how the foundation is involved in the mobile care clinic.
So for actually 5 years before I actually started here at Terrebonne General, we have been actually fundraising for specifically for the clinic, for the mobile clinic. We have done so many different fundraisers in the last 5 years, and we're so excited to be able to provide $75,000 from the foundation to be able to help purchase this mobile care clinic. We just feel as though that it is one of those things that is so critical in our community. And I think it was in 2022 when the needs assessment came out. If our community needs assessment in our area, one of the primary things was access to care. And, it's so important for us, as Mary said, to make sure we get the care down to the lower regions, to make sure that those patients or the people down there are actually able to get access to care that they need.
And why was this so important to the foundation?
And, again, it fits perfectly with our mission, promoting health and wellness in our community. Like I said, we are completely dedicated to helping to improve people's lives in the Bayou region. And this is just one of the ways that we're going to do it.
All right. And what are some additional collaborations that the mobile care clinic will fill?
So, one of the things that we learned during the storm is that it's so critical for us to be able to get out to outreach during the storm. There are people whose houses were damaged following Ida and who had no means of being able to leave their homes or leave the area. So this is a perfect opportunity for us to be able to take the mobile unit during natural emergencies, natural disasters, and take them down to the areas where they need the most help.
Right. Sounds like a great mission and goal. And Mary, in summary, can you tell us what the main community benefit is going to be for the mobile care clinic?
Absolutely. The main benefit is actually to improve the overall health and well-being of our community and to be able to provide additional services or to expand the services that we are able to provide to those that are truly in need.
For more information about the Terrebonne General Mobile Care Clinic, visit tghealthsystem.com. Thanks so much for being with us on To Your Health. I'm your host, Rhonda Alfred, and we'll see you right back here next week.